I will now examine my patient ears. First, I will inspect the outer ear, looking for any scars, lesions, or any deformities, and I don't find any abnormalities. To inspect the inside of the ear, I will use my otoscope. Make sure to apply a clean tip. And before I insert the otoscope, make sure to straighten out the ear canal by gently pulling the patient's ear upwards, backwards, and away from the ear. I will gently place my otoscope inside the ear canal, stabilizing against my patient's face. And I'm inspecting the ear canal, looking for any abnormal discharge, also checking the tympanic membrane, and visualizing the cone of light. And I will do the same for the other ear, following the same steps. I will now perform the whispered voice test to assess my patient's auditory acuity. For this test, I will ask my patient to cover their left ear first so I can evaluate their right ear, and then I will say a combination of 3 words and letters and have the patient repeat after me. Can you cover your left ear for me, please?
A1C.
Okay, so my patient is able to correctly repeat after me, so there is no abnormality in her right ear. Okay, and now can you cover your right ear for me? Can you repeat after me?
T2. 3T2.
Okay, so my patient is also able to correctly repeat after me, so she has no abnormality in hearing on both ears. In addition to the whispered voice test, the other alternative hearing acuity test you can perform is using your fingers and rubbing against in the outer ear of the patient and asking the patient if they can hear the sound, and also checking the other ear as well. So that's the other option for the hearing acuity. You can also perform the Weber test. For the Weber test, use the 512 Hertz tuning fork. You can pinch the top of the tuning fork to make the sound and apply it on the top of the patient's head and ask the patient if she can hear it equally on both sides.
Yes.
Okay. So normal results would be that sound is heard equally in both ears. If the sound does lateralize to one ear, let's say to the right, it can indicate either a conductive hearing loss on the right ear or a sensory neural loss in the other ear. If you do find an abnormal result like that, you can perform the Rene test next. For the Rene test, you use the same tuning fork, pinching the tips again, and then apply it on the mastoid process of the patient, and then move it towards the external auditory meatus, and ask the patient if she can still hear the sound.
Yes.
Okay. Since my patient is able to hear this sound in the outer ear, that is a normal result because air conduction should always be greater than bone conduction. If bone conduction was greater, then that would indicate a conductive hearing loss in that right ear.